Good afternoon. I'm Governor Kate Brown. Today I'm joined by two of Oregon's health leaders who've been working many late nights and early mornings to direct our state's response to the COVID-19 coronavirus. Oregon Health Authority Director Pat Allen and our state's health director, Dr. Dean Sidelinger. The Oregon Health Authority's Incident Management Center has been operating 7 days a week around the clock to coordinate our response to the coronavirus. I want you to know that we are putting everything we have into this response, and we have an incredible team of trained professionals working on it. I wanted to share that Congress has just this morning negotiated a bipartisan emergency funding package of $8.3 billion to combat the coronavirus and help states and the federal government fight this outbreak. Another good piece of news, yesterday I asked Vice President Pence for more flexibility for the states around testing kits for COVID-19. And today we are receiving word that the CDC will be issuing new guidance for testing. Oregon public health officials are working to determine how to best implement this guidance right now. From the outset of this health crisis, I have committed to you that my administration will be as transparent as possible in conveying information to the public. Dr. Allen, Director Allen, and Dr. Sidelinger have been giving daily, sometimes twice daily, public updates so that you can know what we know about COVID-19 in Oregon almost as soon as we know it. And today I'm here with Director Allen and Dr. Sidelinger to ask them some questions that we are hearing from you about the coronavirus. So first, why don't each of you give us a quick update about where things stand? And thank you so much for joining us. Director Allen.
Thank you, Governor. I want to echo Governor Brown. We understand that people are concerned and have a lot of questions about COVID. It's reasonable to take this very seriously and to be concerned. The health authority takes the outbreak extremely seriously, and we're doing everything we can to work to contain it. Here's what we know right now. COVID-19 is in Oregon. We have one confirmed case by CDC and two other cases that are presumed to be positive cases that we're waiting for confirmation on. We also have 29 negative tests and a number of tests that are pending. What we do expect, though, is that there will be more cases in Oregon, and the disease is spreading through what we call community spread. That means it's not related to travel outside the country or any other area. It's being spread from person to person within the community, and we believe it will continue to spread. We're learning more every day. We're sharing facts. We're providing updates and trying to keep people informed, especially in schools and healthcare settings. We're doing everything we can to stop the spread of COVID-19 and protect Oregonians. First, Oregon's healthcare system has been preparing and is prepared for large-scale health events like COVID-19. We have experience with these kinds of issues. The H1N1 virus, Zika, even preparations for the eclipse have helped us be prepared for things like how to provide backup capabilities for emergency medical technicians and those kinds of things. We monitor hospital capacity every day, and we get information about needed supplies and equipment. We have stockpiles of supplies, including gowns, masks, gloves, and those kinds of things. At this time, we have masks and are able and have already distributed them to help provide backup supplies for hospitals and other healthcare providers in the system. And we've asked the federal government for funds to obtain additional supplies. It's important to note in all of these areas around preparation and supplies, it is possible that we could that they could run short or systems could be challenged with capacity, and we're ready to ask the federal government and others for assistance if that happens. Here's an example of how the system works. The state public health laboratory became capable of testing for COVID-19 last week. We're able to process about 80 tests a day at the state, at the laboratory. We do that about twice a day, and so we're able to turn around tests very quickly. What that has allowed us to do is identify these positive cases and begin doing contact tracing to be able to identify people that our cases have been in contact with and be able to take appropriate measures. Second, we have the tools we need to be able to slow the spread of COVID-19. Public health officials in my agency have the authority to isolate people with the virus, and we're able to take other actions. As OHA director, I can take special purchasing actions to acquire the supplies that we need and be able to take steps to help our healthcare system be prepared. State agencies are taking urgent and coordinated action. The governor last week stood up a coronavirus response team across multiple state agencies. We have a multi-agency incident management team at the Health Authority, and the state's emergency coordination center is in operation so that we can apply the resources and tools of all of state government to this issue. OHA public health experts are working closely with schools, higher education, and agencies serving vulnerable populations to share information and take action. Now I'd like to turn it over to Dr. Dean Sidelinger, Oregon State Health Officer, to give you an update.
Thank you, Director Allen, and thank you, Governor Brown. I know that many of you are worried about the coronavirus outbreak here in Oregon and in the United States. As a doctor, I understand those concerns, and I'm here to share the information we have about what we know and what we don't know about this infection. And also to tell you what are some steps that you can take to help us not just protect your health and the health of your family, but to protect the health of the broader community. As Director Allen told you today, we have 3 cases in Oregon, and 1 has already been confirmed by the CDC, with expectation of confirmation on the other 2 hopefully coming in the next few days. All of these cases were adults. 2 of them were hospitalized, and 1 is recovering at home and didn't require hospitalization. We've had a total of 50 persons under investigation. All of these were folks who had symptoms of COVID-19, but not necessarily the virus, but they may have been exposed through close contact with a confirmed case or through travel. Regions that have been especially hard hit in the rest of the world you've heard of are China, Iran, Italy, Japan, and South Korea. We've also been testing and trying to identify folks who are hospitalized with serious respiratory problems who don't have another explanation, and they would be considered potential cases for COVID-19. Again, we have 3 positive cases here, but the good news is 29 of the tests we've done have been negative. And we have 18 additional samples that we're testing now, and we continue to receive samples daily that we will test. 115 people right now are being monitored by our local and tribal public health partners. What this means is they may have had an exposure to someone with COVID-19, but they're healthy and don't have any symptoms. So we've asked them to stay home while they're sick. And this step can help prevent the spread throughout Oregon, and people have been very cooperative, and Oregonians have stepped up to take these steps to protect the health of the public. COVID-19 spreads similarly to the flu. It's easiest to transmit from one person to another when they're close, when they're within about 6 feet, through the droplets in a cough or a sneeze, or what can land on surfaces. It's not nearly as contagious as a virus like measles that we talk about, but it's much more contagious than something like tuberculosis. But to be clear, someone needs to have close contact with someone with COVID-19 to really be at highest risk for this infection. Most people who get COVID-19 experience mild flu-like symptoms, and that's the good news. These typical symptoms include fever and cough, and about 4 out of 5 cases, they're very mild. It's those more serious cases that require hospitalization and a few that can be more severe that we're most concerned about, and I think that have created the most fear. If you're concerned about that you have COVID-19, you can talk to your healthcare provider. But what we're saying, if you have mild symptoms and wouldn't have sought care for the symptoms you're having 3-4 months ago, don't seek care now. Stay home until you recover, and that's the best thing you can do for your own health and the health of those around you. If you want to seek care with your provider, call ahead so they can limit spread within the office. And as always, if you have urgent medical needs, call 911. We currently don't have any constraints on testing here in Oregon. Our Oregon State Public Health Laboratory is able to process up to 80 tests a day and is building surge capacity that we can use as needed. We have the adequate supplies on hand to perform approximately 1,500 tests, and the Centers for Disease Control and Prevention has pledged to replenish our capacity as needed. And today our federal government announced that, as you heard from Governor Brown, that they're relaxing some of these testing restrictions. And we have a team of public health officials working very hard right now to say, what does that look like in Oregon, and how can we best use this flexibility to protect the health of Oregonians and identify what's happening here in Oregon. But again, I want to remind you of some steps that you can take, that we can all take working together. They may seem simple, but washing your hands for 20 seconds is one of the best ways to prevent the spread of this disease and other diseases. We want people to stay home if you're sick. Cover your cough and sneeze and wash your hands afterwards. And as with regular preparation, Do you have the things you need at home to take care of yourself, your kids, people in your household? Do you have food and medications and things in case you had to stay home for 2 weeks? We urge you to stay informed. You can go to our website, healthoregon.org/coronavirus. And if you have questions that aren't on there, you can call 211 with those questions and they'll be able to get the answers. Because we want everyone to know information about this virus and the steps that they can take, because together we're going to help limit the spread here in Oregon and keep everyone protected.
Thank you. Thank you, Dr. Sidelinger. Thank you, Director Allen. I think we're going to take some questions now from Oregonians. And the first question is from Jay Lith. And Jay Lith's question is, should we be doing more testing? Do we have enough kits?
I think as we saw today from the CDC, the federal government has relaxed the testing so that healthcare providers can work with the patient in front of them and determine if they need that testing. Most people with COVID-19 have very mild symptoms and don't need to seek care. So we're in the process here in Oregon of working on some guidelines that we can provide to healthcare providers so they can do what's best for their patients, the people in front of them, and so that we can test those who are most at risk and help protect the health of Oregonians, and those guidelines should be out momentarily or soon.
Great. But right now we have adequate amount of tests
We
in
do.
Oregon. Great. All right, another question from Pamela. Should people, especially medically vulnerable people, avoid events? And her second question is it safe to go to work or school?
I think as long as you're healthy, you don't have symptoms, you're not feeling ill, you should go to work or school. For those who are medically vulnerable, we ask that you consider some of the same precautions you might take during flu season. Wash your hands frequently, clean the surfaces around you. If there are people around you at work who are sick, suggest that they go home and try and avoid contact with them. These are steps we talk to people about every year, and we would say the same thing today.
Great. The questions keep coming in. This question is from Glenn. And Glenn asks, who needs to wear a mask and why shouldn't people wear one if it works for medical providers?
Right.
And I'm hearing this question a lot as
I've heard this question a lot as well, and I think right now we want to do things that can best protect our healthcare workers. They're our frontline partners in this outbreak, and we want to make sure that they're there to continue to care for patients who may have COVID-19 or other things. So because we know this is spread via droplets and our healthcare providers have a lot of contact with sick people, we want to ensure they have all the masks and personal protective equipment they need. In a healthcare setting, if you can't come in and you're sick and coughing or sneezing, you may get a mask, and that's to help prevent the spread of those droplets. And you may ask, well, why shouldn't I wear that mask all the time? And when you're out in the community and not having as close a contact as you do in a healthcare setting, that mask isn't nearly as effective. And for people taking it on and off, kind of may give them a false sense of security, and they may actually spread the virus more widely. So in a general setting, the mask isn't going to provide protection to the person who's healthy and doesn't have symptoms, and it isn't going to necessarily help that person who has symptoms prevent spread to those close by them. They should really stay home and isolate themselves. And those masks, particularly those N95 masks, are really safe for our healthcare providers who are most at risk, and we need them as partners to help us care for people.
Great. Thank you. So Lindsay asks, who should I call if I think I have COVID-19? Should I go to the ER?
Depends how sick you are. If you're concerned that you think you're sick, certainly call your provider. But don't just walk into a provider. If you have a medical circumstance that's the kind of thing that you would ordinarily call 911 for, by all means, call 911. Tell them why you're calling, and that way the responders who are coming on that call can adequately protect themselves. But it really is the same as any other kind of an illness you have. If it's the sort of thing you would ordinarily go to a provider for, call the provider. If it's ordinarily the kind of thing that you would stay home for a few days until you feel better, do that.
So Lindsay's other question is, what if I don't have a primary care provider?
Certainly you can look for a clinic near you and urgent care near you. If you're sick enough to go to the ER, as Director Allen said, make that call. But pick up the phone and call a provider who's near you. See if they can help you out. See if they take your insurance if you have your insurance. And if you don't, many of our community clinics have a sliding scale, so they'll be able to see you so that this isn't something that would burden you if you're worried about your health.
Great. And this question is from Ellen. And it's a very important question right now, and that is, how long can the virus survive on objects, bedding, doorknobs, countertops?
So we think for hard surfaces, we're still learning more about this virus, but it seems to be fairly short-lived. That's probably in the range of several hours, so 1 to maybe 3 hours. There are studies out there with other coronaviruses that they can last anywhere from as short as an hour to closer to 9 days, but we think this virus probably 2 to 3 hours. The good news is you don't need any special cleaning products to kill this virus on surfaces. The routine products you have at home or you have in the office are going to work on this. So if you're cleaning surfaces regularly, that's one of the best ways to protect yourself and those around you.
Great. And I assume both in schools and in workplace environments, it would be really important to be cleaning those items that are regularly touched. Doorknobs, computer screens, elevator buttons, what else?
Stair rails.
Stair rails, okay. All right. This question comes from Louie. Should we deep clean businesses, and what should businesses be doing right now?
I don't think we need to deep clean businesses particularly. I think maintaining a regular schedule of regular thorough cleaning is the right thing to do. It's a good thing to do all the time, especially during cold and flu season. In terms of businesses, we're not at a place where we're asking businesses to behave differently or stop doing things. That could happen in the future, but right now we want Oregonians to go about their regular daily lives.
And what businesses could do is push out messages to their employees about keeping themselves safe, washing their hands, staying home with their sick, remind them of their sick policies so that if they need to use them, they know how to do that.
Businesses should also be prepared, just like individuals should be, in case something happens. And so thinking about your telework policies, or the ability of your employees to have work they can do from home, supplies that you have, things that, in case there are disruptions, those are all good for businesses to do as well.
Continuity of operations plans.
In fact.
Right.
So I think one of the important things for Oregon families is that this is a really good time to be prepared for any type of emergency, right? Whether it's a winter storm or an earthquake or a very bad virus. And that entails each household having a gallon of water per person for 2 weeks. Non-perishable items. I don't know, Dr. Sidelinger, if you want to share your favorite non-perishable items.
I think, we've definitely seen a run on toilet paper out in the community, as we've seen in the media. I think maybe even Director Allen is stocked up. But just having the supplies you need every day at home is something important. Unlike in a natural disaster, we hope we still have access to water, but having those food and beverage items are very important, not just at this time, but in general. And having that plan for what to do if you're a parent, if you get sick or your child gets sick, how are you going to best care for each other, and do you have a plan for missing work or missing school if needed?
I was a little bit puzzled at first when people ran out and bought toilet paper and water and those kinds of things that don't have a lot to do with this, but then I got to kind of thinking we've been telling to do that for the better part of 10 years, so okay,
let's get
it.
prepared. And it also includes non-perishable food items, right? Like peanut butter, some other folks like Spam, but obviously there's a lot of non-perishable food available that folks could stock up and then be ready anytime there's an emergency.
Yep.
So Tony is asking, and actually very good question, how is OHA ensuring people under monitoring or quarantine are staying under quarantine or being monitored?
So this is a practiced skill that our local public health partners have. They have staff who, if they have people in their community who are under monitoring, they check in with them daily to check on them for symptoms, to see if they're staying in quarantine. And part of that is to build a rapport with those people so that if they start getting to a place where they might consider not complying, they're able to talk them through that. We've done this kind of monitoring and quarantine before and have had, in fact, a very high compliance rate. It's really quite successful.
And you have no concerns that folks are not complying with that request?
I think that we're able to manage those kinds of circumstances, usually through the rapport that local public health has, but we've also got legal tools available to us if we need to.
But again, I think everyone has a role as well. So what we're seeing with people is, as we tell people to stay home if they're sick, that they're doing that. And we hope that they'll stay home if they're sick. Once they're recovered for 24 hours, they can return. They may never rise to the attention of our local public health and tribal public health partners. But when they do, Oregonians have stepped up and been very willing to cooperate.
And as you know, Governor, Oregon is one of the few states that has paid sick leave, and so we really do want to encourage people when they're sick that they need to stay home.
Really important policy. We want to make sure if people need to stay home if they're sick, they have the ability to pay the rent and make other bills. So Jessica is asking, why are we not getting a detailed list of possible exposure sites?
So I think every disease is different. So she may be referencing what we do when we have a measles case and there's some potential exposures. Measles is highly contagious, probably 5, if not more times contagious than this virus. And so if someone's in a large room and leaves, that virus can stay in that room for up to 2 hours after the person leaves, and anyone who is in that room who's not immunized, who hasn't had the vaccine, may potentially come down with the disease. COVID-19 really requires more close contact. A person coughs or sneezes, those droplets come out, and those usually spread within about 6 feet. So if someone's within that 6 feet, they're potentially exposed, but if they're washing their hands and not touching their eyes and nose, they're going to be safer. So we don't announce the exposure sites because it really requires that exposure to the person, and public health, our local public health partners have been very good about identifying who's at risk once we've identified these cases.
And then do follow-up contact tracing
Correct.
to let folks know.
Correct.
Mm-hmm.
So you mentioned vaccines. Is it too late to get, if you haven't gotten your flu vaccine this year, is it too late?
It's never too late to get your flu shot. Flu is still circulating in our community, so I implore all of those who are watching to get your flu shot.
So Tricia asks, are there symptoms aside from fever and cough?
This tends to cause lower respiratory infection, so it's that cough may be one of the first symptoms. Trouble breathing would probably follow that. But it's not, it is fairly typical. We might see these symptoms in flu, but it really is that cough and trouble breathing, not just a runny nose or a sniffle. And if you have hay fever or seasonal allergies, and this feels, this is your seasonal allergy, like sniffles, that's probably what it is. This isn't COVID-19 just because it's in our community.
This question is from Sharon. If infected people can spread it without symptoms, how can we keep it from spreading? And this is a really good question, right? Because we know obviously there's community spread happening.
I think we're learning more about this virus every day. And what we seems to be showing is that people are most contagious when they have symptoms, and it's that droplets when they sneeze or cough that spreads the disease. There have been instances reported of people before they develop symptoms, or even after their symptoms have gone away, that they can spread it. But they seem to be most contagious when they have symptoms. But then again, that's why we recommend everyone does the things we recommend: washing your hands, not touching your eyes or nose, using routine cleaning products to clean down surfaces, and that's going to prevent the spread of disease, even if someone has it in the environment.
And
Cover
I was going to
yourself.
say, coughing or sneezing into a Kleenex or
Correct.
your elbow. Okay. We have one last question. This question is from Ted. We will be traveling to Central Oregon. Should we cancel our travel plans?
No.
Okay. No question in either one of your minds?
No.
Okay. I guess with that one, we get one more. Maria wants to ask, what plans have been made to protect the homeless?
I think, we are always worried about our populations who may be more impacted by a particular disease or may not have the resources. And we know the homeless population could fall into both of those categories. Our partners in the Portland metro area have done a lot of work with what to do in an outbreak. We've had experience in the past with shigellosis outbreaks in the homeless population. We know from other states with large outbreaks of hepatitis A that we have preparations and contacts in that population. And Oregon Health Authority is working with our metro partners to make sure that any lessons or plans they have, we can use in other parts of the state, because we know that other parts of the state have this homeless problem and they have some plans, but we're sharing those lessons widely. We're also concerned, since Maria mentioned homeless or vulnerable populations, doing additional outreach with our skilled nursing facilities and long-term care facilities, so we can ensure that they have the guidance they need to help protect the health of their residents as well as their staff.
As well, organizations that serve the homeless and other vulnerable populations are able to access those stockpiles that we have of personal protective equipment and those kinds of things. And there's a process where they can go through their local public health organizations to do that.
Well, thank you both, Director Allen, Dr. Sidelinger. Thank you both for joining me today. If you have more questions about the coronavirus, you can visit www.healthoregon.org/coronavirus. Translated materials informing about coronavirus are available in additional languages as well. And of course, you can also call the state's helpline at 211 with any questions or concerns. Certainly feel free to leave your questions in the comment on this video, and we'll do our best to answer them in future updates. Thank you all so much.